flashed across the medical horizon, dimethyl sulfoxide. It was touted as a pain reliever which would also work miracles on burns, on acne, even on spinal cord injuries, a kind of jack-of-all-trades among drugs. The medical literature was full of stories about it, some of it pro-DMSO, but much of it con, skeptical, even derisive. The Journal of the American Medical Association editorialized against it, and the FDA, the Food and Drug Administration, refused to okay it for general use, said it had never been proved effective. Nonetheless, 2 states, Oregon and Florida, have legalized it for prescription. And the black market in DMSO has become nationwide. That's how many Americans get it. Meantime, the puzzling story of DMSO continues.
It is largely fueled by the efforts of one man, Dr. Stanley W, an associate professor of surgery at the University of Oregon. For 15 years, this man, some would say this zealot, has been pushing DMSO because he believes so deeply, despite the doubters, in what DMSO can do.
Dr. Jacob, isn't a drug that has so many alleged uses, from arthritis to tennis elbow, from burns to spinal cord injuries, from mental retardation to baldness, isn't a drug like that automatically suspect?
No question. And I think that that's one of the reasons it's having problems. And if I had to do all over again, maybe the major mistake that I made, Mike, in the beginning was to tell it the way it was. I think if I would have said it was good for a sprained ankle, but only if the ankle sprain were on the left side, DMSO might be approved today.
Because its use is legal in Oregon, patients make the journey to Dr. Jacob's office there almost as if it were a domestic Lourdes. As we've seen, Dr. Jacob treats some of his patients topically for their bruises, their aches and pains. But some others of his patients, some of the most desperate, are young people left paralyzed from auto and motorcycle accidents. These he gives DMSO intravenously to relieve the pressure on their damaged brains, to reduce the swelling in the brain or spinal cord. And sometimes, apparently, he gets dramatic results.
I took the swelling out of the spine, and they told my husband on the phone that I would probably be in a chair. I'm paralyzed for the rest of my life. And so we're really excited with the results.
Another Oregonian transplanted to Georgia swears by DMSO. June Jones is second-string quarterback for the Atlanta Falcons. Time was, he says, he could hardly raise his arm to throw a football. He says he'd be out of the game without DMSO.
My problem is in my shoulder, so the simple thing for me to do is I just put this on like this.
Just that much, about an inch worth?
I put about an inch worth, and I'll rub it all around the area, and I'll just leave it sit. Sometimes I put on a little bit more than that. And I'll just let it sit like that for anywhere from 20 minutes to 30 minutes, 15 to 30 minutes. And
boy, it smells already.
In fact, maybe in about 5 minutes, I'll be able to taste it.
That's one small special characteristic of DMSO. It smells like garlic and tastes like oysters.
But if you took a big whack during a game, let's say, and it was black and blue, you'd rub it on.
Oh, yeah. I did this more when I play basketball in the off-season. Sometimes you get kneed in a Charlie horse.
Yeah.
Boy, I tell you, those things are painful for days.
Right.
I put it on right after, and I may not have any pain the next day at all.
Jones says several of his teammates use it too, but they wouldn't talk about it in public because talk of any drug, especially an illegal drug, is verboten in the NFL.
In our business, availability is the most important thing. In other words, if a guy gets hurt, he could lose his job. So when someone comes to me and asks me for it, I give it to him. And whether I'm legally okay to do that or not, I really don't care the repercussions because I know I'm going to help somebody.
Perhaps more typical of the legions who depend on DMSO are those who suffer chronic pain. Emily Rudik suffered searing, unrelenting pain from arthritis for years, and she could find no relief, she says, until DMSO. She'd no longer be playing the piano without it, she told us.
I have some very badly gnarled fingers from arthritis, and the DMSO eases the arthritis right away. It's not a miracle drug, doesn't really cure it, but it eases it.
And it does other things for her, too.
I had a fever blister on my lip. I used DMSO 3 times, and the fever blister went away immediately. I've cut myself in the kitchen, and sometimes quite badly, and have used DMSO on it, and the cuts begin to heal right away.
How does DMSO work? What does it do inside your body that kills pain and helps healing?